Hello, everyone. I'm Kimberly James, Director of Education with Image Skincare, and I would like to welcome you to day 3 of ESTY Talks. For those of you that may not be familiar with ESTY Talks, this is our 3rd year of bringing together licensed professionals with our beloved image end consumers, those of you that are purchasing image skincare and visiting our wonderful professionals to receive image skincare treatments. This has been such a success. We started this during COVID, and it was such a hit that we subsequently decided to bring it back year 2 and now year 3. So I hope that those of you that have been able to join us the past couple days have really enjoyed getting to know our professionals, and we certainly have enjoyed coming together to bring you not only the professional side of the industry, but also education for, as I mentioned, our consumers. So thank you again so much for taking time to join us today. I'm very excited to have a special guest and actually a special edition of ESTY Talks. We are calling this ESTY Talks Extra, and today's edition is a med spa edition. I think all of us can agree, whether we're the licensed professional or the consumer that is buying skincare and going to the professional, that modalities and technologies are really a must-have in the industry today. We love getting different treatments that are elevated with different technologies and modalities, and today we are going to showcase that to you. So I'm super excited to introduce you to today's guest. Just a little bit about our guest today. Her name is Teresa Clemens, and she is a licensed medical esthetician. After a corporate career in the fashion industry, Teresa became a medical esthetician and skincare trainer in 2015, utilizing advanced modalities like nano-needling and jet plasma. She specializes in achieving deep dermal repair with less injury to the skin. So without further ado, I would like to welcome Teresa. Hi, Teresa. Thank you so much for joining us today.
Hi, Kimberly. Thank you for having me. Hello, everyone.
Teresa, to begin, I would love to talk to you, ask you a little bit about your joining Image Skincare and how you came to work with Image Skincare products and really come to partner with the brand.
It was a great question. Back in 2015, when I was in aesthetics school, Image has always done such an amazing job of infiltrating us esties, when we're first learning, all the way up to, seasoned professionals. And I was so lucky to get introduced to the brand back then. We went to, at the time, we had a wonderful rep, and she used to do continuing education classes. So she not only came into our schools, but she would invite us to the education classes, and we would learn so much just outside of school. And literally since 2015, when I joined Walnut Creek Aesthetics, I'm a partner with 2 of our professional nurses, a nurse practitioner and an RN. And we've been working together ever since then. And I brought on Image all those years ago, and we've used it ever since. And to this day, in all of our skincare sales and treatment room alike, I primarily use just Image professional products with fantastic results, but also our, oops, sorry guys, also our skincare, the top 3 sales every single month for patient satisfaction. Image is always in the top 3. So we can't get enough of it, and staff, myself, and patients alike, we love it.
Well, of course, we love to hear that. Education is definitely one of the pillars of Image Skincare. So professionals out there, if you're not aware, we do have a ton of educational resources for you. There is no charge to you. So if you want more information, please reach out to Image Skincare, and we'd be happy to direct you. We have an Image Education Center, so that's available to you. And of course, for those of you consumers that are non-licensed professionals, we equip our professionals to really provide the best services to you. And of course, today we're going to be talking about technology and modality, and that's something that is so very and vitally important, that you are visiting the professional. There's tons of information out there on all these social media platforms, but you really don't have any reliable way to look at credentials, or how sound is the information. Has that person that's sharing information been a licensed esthetician? Have they even gone to school? So again, that's why we feel it's just so important to really bring together our consumers with our professionals, because at the end of the day, it's the licensed skincare professional that's going to give you the best guidance and really curate the most custom tailored regimen and treatment plan for your skin. So with that said, I would love to know, Teresa, what are your 2 favorite image products?
Okay, so I always, educate patients on the importance of protecting and preventing during the day, resurfacing and repairing at night. But today I want to focus on the 2 top products that we literally can't keep in stock. One is the Image MD Power C. It is a phenomenal vitamin C that also has ferulic acid, which helps bring down the vitamin C even deeper and gives it even more benefit to the skin. So the vitamin C gives us that internal protection. Then when we apply our SPF moisturizer, that's our external protection. That combo gives us 800 times better protection than if we just use sunscreen. And men, women, I mean, the vitamin C is a creamy texture. It's so hydrating, but it melts into the skin. It gives you just this beautiful glow, and you're getting that internal protection as well. And then with our the Prevention Plus, the daily hydrating moisturizer, I honestly, besides the brand new sun serums that just came out, which are incredible, this is one of my go-tos for every patient, men and women alike. It is a daily hydrating moisturizer, 17.1% zinc. And honestly, you guys, it's the most elegant zinc moisturizer with SPF that I've ever seen on the market. The way it comes out a little bit white and a little bit thick, but you just massage it and it just melts into the skin. It leaves such a light glow and finish to the skin. It's hydrating, but doesn't feel greasy. It's such a phenomenal combo, those 2.
Well, I 100% concur. I have to give a little additional plug to the new MD Power C serum. As Teresa mentioned, it is amazing. I also am in love with the product. Not only does it have that C and E and ferulic acid that Teresa mentioned, but there's also a unique ingredient called acetylzingerone. And there's some great, actually an abstract written by a physician that did a study partnering the 20%. It's called tetrahexadecyl ascorbate. That's the oil-soluble form of vitamin C that's in the product, with this acetylzingerone, and the support that ingredient offers to that very high potent level of vitamin C is amazing. So you get great stability. So I can't speak highly enough of this product. Professionals, if you're not carrying this, you need to order it today and get it into your retail section. And for those of you out there that are using Image Skincare and you haven't tried it, you need to purchase this from your professional today, because you will fall in love with it. Game changing, it gives a glow to the skin. And there was something else I was going to say about it, and I just lost it. But anyway, you will absolutely fall in love. Leaves the skin dewy. So I agree with you there, Teresa. It's definitely a favorite. So today we are going to be talking about a specific modality, and that is nano-needling. One of my favorites. I am so glad that I'm the one that gets to be here with you today when you go through this demo. I think this has just so many benefits for the skin. It's fun, and you just receive such advantage from this treatment. So Teresa, let's start by telling our viewers a little bit about what nano exfoliation is and some of the benefits that the client is going to receive from this treatment.
Absolutely. Nano-needling is such a, sometimes I think it's undervalued because we always hear microneedling, and of course microneedling is essential, especially in the medical world. But nano-needling is the stepsister, if you will, that does so much more than instead of using any needles, it has a stainless steel tip that almost has a little like a pyramid type shape. And the nice thing about this treatment is it's safe for, you know, all skin tones and skin types. Men and women both like this. It not only gently helps exfoliate the surface layers of the skin, but it also helps to open up our pores, and the product can penetrate even deeper. So during a treatment, as you'll see in just a moment, we're going to use a nice some enhancers on the skin to give the skin a nice slip, and then we'll just go in a cross-hatch pattern over the face. But we'll do that, and then once we're finished, we're going to apply the enzyme peel. And these results, everything coming out of Europe, you guys, Europe's always ahead of us when it comes to, you know, aesthetic technology. And we're so grateful that we learned so much from them, and we finally end up getting it in the US. What's been coming out of Europe is deep repair to the skin, but with less injury to the skin. And this is such an amazing treatment because they found we can still give these same deep, beautiful results. It might take us a little longer, maybe do several more treatments in a series, but it's something that we can do any time of year. It is not specific to, you will have no downtime, and it's not specific to any season. So it's something that's so user-friendly for everybody. Patients, every single time I've done this treatment, patients love it. They can go to an event, they can be on Zoom for work, they can travel and just have all the deep benefits with none of the downtime. So it's a really great treatment.
I think you've made some great points there. Safety being number one, not creating trauma to the skin. Obviously, the skin is going to have a response if we create trauma, and that certainly can lead to post-inflammatory hyperpigmentation, issues that we didn't even have to begin with. So I think that's so valid, and especially for our US market, where estheticians are able to perform this treatment. They don't have to have licensing and so forth. I don't know if you professionals know this, but we actually comply with EU standards. So when we bring a product to market, we don't comply with just FDA and US standards. So we make sure that our formulation is meeting the rigorous requirements of the EU. I love that about Image Skincare. I 100% agree with you, Teresa, that they are definitely well advanced from the US. So that pairs beautifully. And professionals, I'm not sure if you're aware, but we do have protocols, and you're going to see how Teresa successfully uses Image Skincare with her nano exfoliation treatment today. And consumers, I think it's really important for you to be aware that you want to be working with your professional. I see all kinds of tools out there on the market. And of course, everything is marketed to bring you these fabulous results. But as Teresa mentioned, you really can create or injure the skin if you're not careful. And your licensed professional knows how to analyze your skin and how to perform a treatment to not have any adversity or reaction or trauma to the skin. So I think, again, just reiterating the importance of coming together and really visiting the professional so that they can give you the most advanced treatment in the safest format. Would you agree with that, Teresa, when it comes to those at home? Not that I'm knocking them, but what would you say about that?
I couldn't agree more, Kimberly. Literally, as a professional, the first thing I do is sit with every patient and talk to them, during their consultation, and not only ask them about their home care and what they're using at home with their products, because we know our home care is 75 to 80% of our skin health. So that's one of the number one things I talk to them about. But also if they are using any at-home devices, some use, the gentle exfoliators, those are great. But, I've even seen online, YouTube, TikTok, where there's people at home injecting themselves with fillers and Botox. I mean, it's so dangerous that people go as far as, thinking they can do it on their own. Something even simple like this. Those devices are over the counter. They aren't medical strength. And when you come to your professional, we've not only done, been certified to perform these treatments, we've had them done on ourselves so we can truly help guide you through the whole process, but truly also let you know what you can do at home and how you can keep your skin prepped with your AM and PM routine. But then you come to office and we're able to give your skin an even greater treatment without you having to do any of the homework or worrying about any of the side effects. So that's our job, and we'll take great care of you. And you're so right, Kimberly. It's important to just remember to trust your professional. That's what we're here for.
Absolutely. Couldn't agree more. Well, with that said, I think we want to see the professional in action. So we're going to go ahead and turn it over to you, Teresa. And Teresa is going to talk us through this beautiful treatment. We are monitoring questions, so we'll do our best to answer questions as we're going through this. But Teresa, take it away. We're excited to see the demo.
Hi guys. Okay, I'm going to just adjust my computer screen here a little bit so you guys can see my beautiful model here, Miss Najma. And give me just a moment, guys. I'm going to get some gloves on and we're going to get started, okay? And what I'm going to do, I'm going to talk to you guys while I'm prepping real quick with my, I always wear gloves in every treatment and I use some really nice vinyl gloves that feel almost like skin. So I try to give it such a nice tactile treatment for the patient. But we're going to start out using our ageless cleanser. I love this cleanser, you guys. It is fantastic for gently exfoliating. It's almost like a lightweight gel base, a really nice glycolic, which is gently just kind of eats away the brick and mortar in the skin. And then there's also aloe, which is very calming. And then there's a menthol feel to the cleanser. So it's very effective for not only exfoliating, but also the patients love it because it just feels so cool and fresh on the skin. So I'm going to add a little water and we're going to start her cleansing. Okay, guys, and I'm just foaming it up just a little bit, and then we're just going to do a nice facial cleanse. And with my facial cleanses, even though we're a medical office and we do all of the medical aesthetic treatments, I still always like to, typically when I'm in treatment, I turn the lights down, I have really wonderful spa music playing, and I do a full facial massage for the patient. So with lymphatic drainage, as well as some pressure point massage to really give them not just a rush, hurry medical treatment, but a full, massage and facial treatment as well. And notice how I'm doing just a little bit of this lymphatic drainage. It really just helps to push out any toxins that are in the skin. And patients always leave feeling like their face is a little bit more sculpted. So it's a nice addition to add on.
And I imagine it feels amazing also.
Sure does. And I like to do just a little bit here at the cheek. And even in where most people can get some TMJ, just really nice in there. Some pressure points here. And believe it or not, for patients alike, if you've had me do this on you, it's wonderful to do just a light little ear massage. There's so many pressure points in our ears. So this always feels really good just to do a nice cleanse there and behind the ear as well, because even though we all clean behind the ear, sometimes we can't see back there. And so it's a nice addition to be able to do that for the patient. And
those are great tips, Teresa. And I think little tips like that can make such a difference in a treatment. So we appreciate you sharing those with all of us.
Absolutely. It's nice to have little pro tips that we can share with each other for sure.
Absolutely.
I'm going to just get some sponges and do a rinse here. Okay, guys, get some. And I like to use warm water when I am removing the cleanse, just to leave a nice warm sensation on the skin. But later on, when we apply the peel, we're going to be using cool water to remove it, just so there is no heat applied with the enzyme treatment. Okay, so just a gentle. And you guys can maybe see just from me doing this cleanse, how nice and light her skin, bright, or it already looks more bright and exfoliated just from that gentle cleanser with the glycolic in it. It's so nice because if you do this, it's safe to use daily. So it's not something that you only can use, once a week. Some people like to cleanse in the shower. You can do, maybe a creamy cleanser first if you'd like, and then you would add this maybe as a second cleanse. So there's so many different ways that you can incorporate. But what's so nice about having an exfoliation step in our cleanser is that helps maximize our time in the morning or in the evening. So you're cleansing, but you're also gently exfoliating. So it's a great dual modality just with your cleanser. Oops. Okay, guys, now let me do one more quick cleanse. We always do 2 cleanses on the skin. And for my medical estheticians, ageless is great for all of us professionally, because of the gentle, the glycolic and the gentle exfoliators in there. But for my medical estheticians, you could also use the MD restoring cleanser that has not only glycolic, but also lactic and salicylic. So that does give even a little bit of an extra when you're cleansing. And it also has that cooling sensation, so it's really nice.
Question for our viewers that maybe are not familiar with the ageless cleanser. Any activity on the skin? What can they expect when using the ageless cleanser?
It feels, in fact, Najma, how does that feel on your skin? Do you feel it like a gentle little tingling?
It's cooling.
Yeah. So it gives them, there's a menthol in there, so it gives a nice cooling effect. It feels great, especially in the warmer months. It's just really nice. So it feels really nice on the skin, doesn't it? And this is, I've even had professionals tell me they like to use this for women if they shave, legs or bikini area. It leaves a cooling sensation. It has gentle exfoliators in it, so you won't end up with some ingrown hairs. So that's kind of a cool little trick too. And men like this too, because as they shave, it's cooling on the skin.
And I'll interject that I actually have very dry skin and still have such great success with the ageless cleanser. So it is great for all skin types as well.
It sure is. And I'm like you, Kimberly. I have normal to dry skin, and I like this because even though it's exfoliating, it doesn't leave my skin feeling tight. And that's one thing what I love about Image products and their cleansers specifically is we all used to, back in the day, we were taught to cleanse and then tone, which toning is great. I tell patients, if you tone, you can still tone, but the way that Image has formulated their cleansers, you don't need a toner because they help keep the pH balanced. And that's the whole purpose of using a toner in the first place. So I always talk about products working smarter, not harder. And this is exactly one of those products that will multitask for you to give you even more benefits just outside of cleansing. And as you guys can see, she looks nice and clean and bright and fresh. Okay, so now we're going to move on. You guys are going to do what we call degreasing. In medical offices, a lot of times we use an acetone, or rubbing alcohol, and it's of course very effective, but it's so strong that a lot of times patients don't enjoy that experience. And so I'm so in love with the peel prep from Image for the professionals. If for patients, if you guys have been in any of my treatments, you'll know that this is one of the patient favorites as well. It smells so fresh. It's got some citric acid, some glycolic, some salicylic. It's almost like a mini peel, but without peeling the skin, it helps to just remove any lipid barrier, oil barrier on the skin. So that's what we're going to do after our double cleanse. We've got the skin nice and fresh, and now we're going to do a little bit of the degreasing, which I just squeeze out any excess. And we're just going to go around the face in a crosshatch pattern. So I am going to go, and I use some firm pressure with some rough gauze. Okay. And so you'll notice some erythema, which is just some redness and pink to the skin, which is good. That's what we want. And we are actually plumping the skin and bringing the blood to the surface as well with this degreasing technique. And I like to pull the skin taut, and I let the patient know we are going to be using some firm pressure. And I like to do even underneath. And if I'm treating their neck, I would also do this for their neck. But today we're just going to focus on the face. And then we're going to go across this way.
Is our client feeling any sensation with the degreasing prep solution?
How does this feel on your skin, Najma?
It feels good.
Does it feel tingly at all? Or
A little bit.
Yeah. And that's what's nice about this, guys. As another pro tip, I use this at home when I want to, if I don't have time to do my microderm exfoliator in the shower, which is another product we'll talk about later that's just incredible. But this is so great because it gently exfoliates chemically without having any, it's just a quick and easy exfoliation on top of after you cleanse. So if you're feeling extra dry or you just want a quick bright step to your skin, this is a great version of a toner that I like to use at home. Okay, so I can even feel her skin. It feels nice and tight and taut. And so we have prepped the skin properly to begin, or I'm going to show you guys right now what I'm going to add to the skin. Before we start the nano needling treatment, I am going to use 1 dropper full of this is the hyaluronic acid enhancer. It's a concentrated formula of different types of hyaluronic acid that will actually penetrate deeper into the skin for great hydration. And then also the antioxidant enhancer, again, another concentrated serum, if you will, that has just multifaceted antioxidants in them that are super strong and healthy for the skin. So I'm going to combine these two and we're going to apply this on the skin for a nice slip when we do the nano needling. So let me put these into a little medicine cup, and then we're going to apply that.
And again, I've seen some questions come in. Just to reiterate, this is such a wonderful treatment because our licensed professionals can perform this. They do not have to be a medical doctor or in a medical doctor's office. So this is nano needling, which uses as Teresa mentioned, more of a pyramid shaped tip. The tip's a little bit different, and it's performing an exfoliation and allowing for depth of penetration. But it's wonderful because all of us licensed ESTYs can perform this treatment. So that's very exciting.
Got it, Kim. And to my professionals, your patients will love this. Even do this on yourself so that you can experience it and see how it feels and how great your skin looks. Because when patients see our skin and what we do and how we take care of it, you know, we're basically advertising our own services. And this is just, like I said, such a user-friendly treatment for any time of year. And it just helps not only gently exfoliate, but brighten and help penetrate everything down deeper. And that's definitely what we want. If we know, even with our home care, if our products can't get deep enough, they're not going to be able to affect change down in our dermal layer, which is where all our damage starts. So this is just such a quick and easy and effective treatment to do, you know, any time of year. And now, you guys, I'm just brushing on the hyaluronic and the antioxidant enhancer that I've mixed together. And now we are just almost finished. And I'm going to apply more as needed. And now we're going to start the nano-needling. And the nano-needling, guys, there's so many different great types of devices out there. For my ESTYs, this is a great one that I had a nurse actually tell me to get. It's called the Doctor Pen. It's just a phenomenal, it has different settings. But then I ordered these sterile CE nano tips that you just pop it out of the little bag, and then it comes with a little safety on there, and it's so easy you put it on. In fact, you push it down and then you turn it to the left so that it locks in. Okay, so you won't ever have to worry about that popping off during treatment. So what I typically do is I'll have this set up with each patient, and then I leave the safety on just for sterilization and cleanliness, and then as soon as I'm ready to go, I'll pop this guy off, and then you can see the tip here, how it's more of a flat versus the needles, but it's still super effective, and it's going to be using a vibrating sonic motion to apply the serums down even deeper. So we're going to turn that on. I have it on a level 1. You can, if you want it to go even deeper, even level 1 is very strong. So I usually just typically stay with level 1, and we are just going to start on the forehead and just gently go in a vertical manner to start. And then we're going to just keep gliding, and see how easy this just glides on the skin. There is no discomfort for the patient. It actually feels calming. And typically, remember, guys, if we're in treatment as professionals, depending on how you're set up, you can have calming music and your lights dim down. And for patients, you guys, if you've had this treatment with me, you know how relaxing and calming it feels. And we're just
Teresa, we had a question come in about the depth that you're using right now.
So the depth I'm using is just 0.25. You can go deeper, you can make your setting stronger, and you can go deeper. But again, remember what we're doing here with nano needling. It's not about being aggressive. It's about, again, doing treatments that give deep repair with less injury to the skin. So sometimes less is more. And in this case, that's what I always do, is the 0.25 with the setting of 1. But depending on your device, whichever one you choose, I know Image does a great one with biotherapeutics. That one's phenomenal. So depending on your area or whichever device you're using, get to know your device and try it on yourself and, patients alike, and then see what setting the manufacturer recommends, and definitely follow those guidelines just so there's no issues for during treatment. But this always gives such a strong and great penetration, again, without any irritation or injury to the skin. But
that's great info. I was gonna say that's great information for our professionals, and for our consumers. You can see why it really is so really important to pair with the professional, because again, they're able to know what to use, what depth, what setting with their device, so that there is no trauma to the skin. So I think that was a really important piece of this as well.
Absolutely. And that's why, I know this stuff looks easy. And when we see this from beauty bloggers and influencers, and again, no discount to them, they're doing, their role. But, professionally, it's not even just knowing how to use the device and what products we're using, but to really know the skin histology, everything, contraindications that are really important to know. So even though this stuff seems and looks easy, just remember to rely on your professional. We do all the hard work and the education to bring you these amazing benefits without you having to try to do it yourself at home, and again, could cause stress or injury to the skin. And now we're just going over the face in a vertical manner. And how is this feeling on the skin, Najma? Does it feel nice and relaxing? What are you feeling?
I feel relaxed.
Yeah.
Yeah, it feels good.
And I even like to do, guys, the sides of the nose. Don't forget about that because we have pores there. And so we want to open those up. And if you're doing any extractions, professionals, this is a great time with nano needle. You can always do extractions after because everything is more open. And then I like to do a crisscross manner. And why we're doing all this, you guys, with the cross hatching is to just, you know, open up the pores on different levels and working the skin in different formats. So we go horizontally and then vertically, and then we do this kind of crisscross pattern. And there's several ways you can do it. Some people just do a straight crosshatch where they're going horizontally and vertically, but I like to do these little bit of extras just to give the skin a little bit more work. And remember, for professionals, no numbing is required. You don't have any downtime, and there's so many different treatments, especially with image. There's a great signature lift. Today, we're going to be using the hormetic lift, which is phenomenal, but there's a lightening lift. So depending on the patient's chief concern, there's so many great treatment options that you can do. You could even do, you know, the O2 lift after this. I mean, there's so many things that you can combine with this. And then now, guys, I'm just going to finish with some small circular motions to complete the nano needling treatment, again, around full face. And just so you guys know, these serums are enhanced, so they are concentrated and they are just feeding the skin such deep hydration, as well as all the antioxidants. So it's like really healthy, good food for the skin, if you will, vitamins for your skin.
Teresa, we had a viewer ask, does the amount of times you go over the skin with the nano needle matter?
When we're trained, it's just about going in the crosshatch patterns. You don't want to overwork the skin. You don't need to. The device is doing that for you. So it's not about doing, 5 passes of this. It's just you go over the first, you can do horizontal first if you prefer, or vertical. I sometimes I switch that, so it doesn't matter. So horizontal, vertical, then you can do the crisscross pattern and then finish with the circular. So that's basically 4 passes, which is plenty. It really opens up everything and works the skin in a healthy way without, causing stress or trauma to the skin. And it really helps to deep dive all the ingredients down into the skin even deeper, and which is the whole point of doing this, so that everything penetrates down even better. Okay, guys, so, and you will see she has a tiny bit, if you look, she has a little bit of mild erythema, and this is what we want. Some patients don't worry though. Some patients are very sensitive and might be 3 times more pink than this. That's okay. As you get to know your patient, you'll know how their skin reacts. I have some patients, I wash their face and their skin turns bright red. It's just their level of sensitivity. So, but this is just a normal mild erythema that you should see on the patient with the nano needling. Okay. So now, guys, it was literally that simple. I'm just going to push the button here, turn this off, as you can hear the no volume now, and then I just twist to unlock that, and this is going to go into my sharps container. Those are disposable. We don't want to keep those tips. And then we are going to, and if you guys can see just from using the enhancers, look how bright and glowy her skin looks. Again, that pinkness to the skin is actually a good thing because it's helps circulate the blood and plump the skin. So it's very smoothing. It helps to soften any fine lines and wrinkles. But we are going to, in fact, I'm just going to finish kind of patting this into the skin. And then I'm going to remove any excess in just a moment with some cool waters on the sponges. So just to finish patting that in just a little bit deeper. And now let me get cool water on my sponges. Because next we're going to apply the peel, and we don't want any remnants of the product sitting on the surface. So we massage in, and then we're just going to rinse. And I'm using nice cool water So there's no warm sensation on her skin post nano-needling. Just going to
This is a great question that came in. How soon would you introduce this service to a client, new versus repeat client?
Great question. This is something, believe it or not, you guys, after it's all about the your consultation. That's so important because even if it's a continuing patient that we've known for a long time, things change. So each time I see the patient, I always ask, is there any changes to your health history? Say medications, something, an ailment could have changed since the last time you saw them. But what's so great about this is making sure that the patient has no contraindications to nano-needling, like pregnancy, a severe, say, eczema, rosacea, even telangiectasia, which are just little blood vessels that start to, break under the skin. You want to make sure there are the patient hasn't been on any Accutane for the past year. What else? You want to guide them if they haven't used any, say, glycolics or any other types of acids or retinols for the past week. You could do it that day, but you just want to make sure to do a very thorough consult. You could even do, say, a signature treatment on the patient or an O2 lift as their prep treatment the first time if they're a new patient. Then you can set up a treatment plan for them, and that's what I do for every patient here. Even my staff, I put them on a treatment plan because the whole goal is to help them, help them achieve the results that we're looking to improve with their chief concerns. So whether that's pigment or fine lines and wrinkles, acne scarring, there's many issues, rosacea even. And that's what's so great about Image is they have literally something to treat every ailment. But this in itself is so phenomenal because it can be used with most other peels. And like I said, today we're going to focus on the hormetic lift, and I'm going to grab that right now. This is such a great treatment, you guys. It's in an aloe vera gel base, so it's very calming and soothing. It has peptides and stem cells on top of all the organic ingredients that are certified organic. So this is a great treatment to have in your arsenal because whether you're treating, like I said, pigment with a lightening lift, or that we have a wrinkle lift for fine lines and wrinkles. There's an acne lift, of course, for acne, but this is great that can be used on, any patient, men as well. This is very calming and soothing to the skin, but also is packed with tons of organic ingredients that are just great for repair, hydration, brightening, everything. And I like to just do a little bottle shake just to give it a little, and you can hear that, how that it's a fresh bottle. So I'm just opening that up and I'm going to pour in here about 1/8. So some of your measuring cups might have, you don't even have to measure it per se, but see, that's way too much. It came out a little bit fast. So you can even do less than this, and you'll see for yourself. You want to maximize, you'll get so many treatments out of these peels that keeping your treatments measured, you'll be able to do so many wonderful treatments per patient. And you can set them up on a treatment plan. You could do just the hormetic lift with the nano-needling as, a 4 to 6 series treatment plan. And you guys, this smells fun. It smells like a fresh smoothie. It's just divine. It's so wonderful. And again, the patient may feel a little sensation from the nano-needling applying the peel, but they may not as well because it is very mild.
So viewers, for those of you that missed that, she's using the hormetic lift solution. So professionals, that is our professional only, one of our enzyme peel options. And for clients out there, this is, again, it's a professional only product. So you obviously would see your professional, but this is an enzyme peel that works beautifully on the skin. It nourishes the skin, as Teresa mentioned. It smells amazing, but again, this is professional only, so you would see your professional to receive this. Teresa is incorporating this into her nano-needling treatment today, but this also is a protocol on its own that your professional can treat with.
Thank you, Kim. Yes. And just to highlight a few of the ingredients in this, you guys, for patients as well as professionals alike, it is truly, it's got pineapple, pumpkin, papaya, and mango. So when I say it smells like a smoothie, it really does, but think of it like a organic smoothie for your skin. It is so wonderful. And all of those ingredients are very antioxidants. They brighten, they do so many wonderful things that we're looking for in this kind of a treatment. So we are just going to massage this in gently. And Najma, what sensation are you feeling on the skin from the Ormetic lift?
It's very cooling and just a little tingly.
Yep. And this is the thing too, guys, you want to feel a little bit of something, and patients always like that. Sometimes if they don't feel any kind of sensation, they think, oh, it's not working. Well, this, because of the nano needling, all of your channels are opened up, and you can really just give this a nice massage into the skin, which the nano needling has opened everything up. So it's already going down deeper, but I really like to do a nice massage with this.
That's one thing I love about our gel-based peels is that organic aloe vera base is not only such a great carrier of the product and the ingredients into the skin, but it's massageable, which gives you such that beautiful ability to create a spa-like experience, and also even further depth of penetration. So that's another added benefit to our gel-based peel solutions.
And that's why I love them, because like I said, depending on patient sheath concerns, acne, hyperpigmentation, wrinkles, fine lines, and there are patients that only want, that's what I love about Image as well, is everything is clean clinical ingredients. And this is truly an organic, certified organic treatment. So you can also offer this to patients who that's very important to them, to have a pure organic treatment. So this is protocol. We leave this on up to 5 minutes on the skin after we've massaged in. And what we're going to do is, I'm not going to leave it on that long, just for timing for the video, but I will leave it for another minute, and then we'll remove that in just a moment.
Teresa, I think you may be muted.
So sorry, guys. Thank
That's
you.
okay.
Okay. And is this, as it's been sitting for just a few minutes, Najma, is it feeling a little less tingly? How is that feeling for you?
It is less tingly, yes.
Okay, good.
But it feels good.
Yeah, you can see too, again, her skin is still a little bit pink. This is all normal. This is what we want to see. Again, that blood is circulating underneath the skin. We've really stimulated everything, opened up those pores. That pinkness just shows that not only, like I said, the blood is circulating, but we're bringing blood to the surface, and it's plumping. So it has a plumping effect, which is very helpful when we're trying to soften fine lines and wrinkles and just brighten the skin overall. And for patient comfortability, that this is normal. You're going to feel a little bit more tingly after the nano needling, and then you will, the patient will start to feel a little bit less tingly as we go. And I'm going to just apply some cool water now, you guys, to remove the peel. You don't want to use warm or hot water. You want to use nice cool water, just so there's no irritation to the skin. I just do that very gently. I'm gonna do one more wipe down. All right,
Teresa, could you talk to our viewers that are curious about acne-prone clients? How do you feel about this treatment when working with acne-prone clients?
It's a game changer. They will love it. In fact, instead of using the hormetic lift, you would follow the same protocol we're doing. And then with the nano-needling, you could use even just the hyaluronic as well as the kojic acid enhancer, because that helps with acne scarring to lighten that. So there's ways that you can customize, but then I would use this with the acne lift, and acne lift is also in an aloe vera gel based carrier. So it's again very calming to the skin with the active ingredients. So this would be such a great thing to pair the nano needling with, is the acne lift. And remember, guys, for patients and professionals alike, we want, where we're going to see, really good results is with a series. Doing one treatment is, of course, is always nice, and you're going to see immediate results, but to get the deeper repair that we're after and to see the long-term change in the skin, it's with our in-office treatments with your series, typically 4 to 6, depending on patient's chief concern, but your home care is going to be your daily maintenance for your skin, to keep your skin prepped at home with the proper ingredients for your chief concerns. And then when you come into office, your skin responds even better to the treatments that we're offering, because you're keeping your skin prepped with the proper home care at home. All right, guys, so she is nice, and I've got all the peel removed. Her skin is just, you can see that the pinkness is slightly starting to dissipate, which is normal. That's meant to go down and continue to dissipate. So now we are going to use also another favorite. This is called the hormetic serum. This is one of my favorites. It's a balancing antioxidant serum that has all organic ingredients as well. It has an organic version of, I think it's cuckoo. What is it? The cuckoo. It's a natural
Kakadu plum. Yeah, the Kakadu plum.
Thank you.
That's
Sorry.
a tongue twister.
It sure is. That's such a great ingredient, because it works like a vitamin C in the skin to give you that deep protection internally, as well as tons of other antioxidants in here. So I'm going to just take 3 to 4 drops of this, guys, and emulsify that. See how it's kind of just a lightweight gel formula. I'm just going to emulsify that so it doesn't drip, and then just massage this into the skin. I even use a sonic gold roller sometimes to massage in my serums. It feels phenomenal on the patient, and again, just helps to penetrate even deeper. But today, since we've done the nano needling, we don't have to use that. And this, you guys, texture-wise feels, again, hydrating, but not greasy. This is also great for all skin types, skin tones, and it addresses so many chief concerns, all with organic, pure organic ingredients. And so I like to just keep doing a little bit of massage so we make sure that is pressing deeper into the skin. And again, she has just a bright, fresh, healthy glow, and she's got some nice tackiness there, which is what we want to feel. And now I'm going to apply a little bit of one of my favorites. And if you guys know anything about the Max line, professionally or patient-wise, if you haven't tried it, it's a must. It's over, I believe, throughout the line, there's over 40 different botanical-based stem cells that when they were doing clinical trials, they found that not only survived in the harshest conditions, but thrived. So imagine what goes into these products and how those are going to benefit your skin. This is the Max Stem Cell Eye Cream. It's phenomenal. I love, you don't need a lot. You'll see, guys, I'm literally going to pump. I mean, that's probably even too much. But what we want to do is I take just a tiny bit on this finger, and I'm just going to pull softly taut the under eye, and we're just going to pat that in. right along the orbital bone. Okay, you don't have to get too close to the lash line. We don't want it to get in the eye. And then I do outer corner here. Okay. And then literally just a little bit right on underneath the brow bone. And I like to call this the two Chanel C's. You're going to be doing this with both eyes and just a C-like pattern, baby gentle patting. And while we're doing it that way, it's going to help absorb up, over, and down. So you're literally treating the whole eye area without needing to get super close to the lash line. And again, causing any irritation to the eye. And
I
the
like that.
eye,
I'm going to steal that. The Chanel treatment, the Chanel
There
eye
you go.
treatment.
yeah. And when patients when you guys are putting this on at home, you can even do this at the same time. So we can also professionally, you can take it just a little bit on each finger, and to save time, you can just go around like that. And this will help to just absorb right in and without tugging or pulling around the sensitive skin around the eye area that's more thin and delicate. And now, one of my other favorites that we talked about earlier, the Prevention Plus, the Daily Hydrating Moisturizer. This, you guys, is, like I said, a all zinc products. Typically zinc sunscreens, they're great as far as being a physical sunscreen, but a lot of times they leave a very heavy white chalky film on the skin that patients don't like because they don't like how it looks and how it feels on the skin. But this image has made this literally the most elegant physical sunscreen that I've ever used on the market today. So I'm just going to take a little bit here. Literally, that's all you need. You don't need more than that. And there's different ways to apply it. I like to take it and just do a little dotting on the skin around the face. And then I'm going to just massage it in like I would my normal SPF moisturizer. So, and this is where I kind of like to use a little bit of some effleurage for my professionals and just kind of press it down and fluff it into the skin.
I'm just going to answer a question regarding the Prevention Plus. So we do have a couple of different options in our Prevention Plus collection. There was a question regarding the difference between the 50 and the 30. Our ultimate SPF 50 is one of our options, but we also have a daily matte moisturizer that is an SPF of 30. We have a daily tinted option, and we have a daily hydrating option. So there is a difference in the SPF protection number, but also different formulas to suit different skin types. So you have some options there just for viewers that may not be familiar with our Prevention Plus collection.
Yes, and that's such a great thing to bring up, Kimberly, and patients, for you guys that come in for treatments, your professional will help guide you on the proper sunscreen. Believe it or not, most people think they have to use a 50. 50 is better, of course, than the 30, but a 30 gives us a 97% protection rate, and a 50 gives us a 98. So it's such a small degree that you can feel really confident that if you're using your 30, you're getting fantastic sun protection. SPF means sun protection factor, so you're getting a 97%. So don't let the numbers fool you. Of course, if you have a 50, that's that 1% better. So of course use that. But with the image sunscreens, the daily mattifying sunscreen, that's phenomenal as well. Believe it or not, that's great for all skin types. I am normal to dry, and I have used that in the past as well. I still feel hydrated and I don't look dull.
Whoops. Do we have a technical difficulty there? I think we may have lost Teresa. So while we are working to see if we can bring her back on, I'm going to repeat the sunscreen options because we did have a question about those. So we actually have 4 different options in our Prevention Plus collection. One of them is a daily matte moisturizer. That's excellent for oily skin types. Some men prefer that because it absorbs surface oils. They want a little bit more of a matte finish. We have a hydrating option. So for someone like me that has drier skin, that's a beautiful option for me. It is an SPF 30, but it's going to give a little hydration to the skin. We have a tinted, and the tinted is good for all skin tones. So it will blend seamlessly. If it's a extremely light or dark skin tone on either end of the spectrum, it may not be a perfect blend, but for the most part, most skin tones, it will blend in. There is just one option of the tint. And then of course we have our SPF 50, which is the highest SPF, and it's called our ultimate. I'm going to reach out to our global events team because I'm not sure.
Kim, we're trying to get Teresa back. It seems that she
Okay,
had
just
an
checking. I
issue.
wasn't
Yep.
sure. I'm not sure if I'm talking to myself or if we lost Teresa. Okay, so any other questions while we're working to get Teresa back from our audience on anything you've seen? You have me, so I'm happy to answer any questions that come in. I think we had a question, is there a brochure or comparison chart for our Prevention Plus? That's a great question. We actually do have a brochure for both consumers and professionals. Professionals, what I would recommend you refer to is our product and treatment manual. That's going to give you all the information you need. It has spec sheets and just all the information. So if you don't have a product and treatment manual and you are a professional, get one of those in your hands because that's kind of your go-to. For our consumers out there, the product brochure is a great asset if you have access through a professional, but also our website, our consumer website. You can go through and really investigate the different options out there. So that is a great resource for you as well, the website. Yes, and we have new Prevention Plus products, but I can only give you a tease about those because they haven't officially launched to our consumers, but stay tuned, professionals, you know what I'm talking about. We have some new Prevention Plus products, so they're amazing. See your professional if you want to know more. They are soon to come for our consumers. Yes, before the nano-needling, she did add a degreaser, and that degreaser was our eye peel degreasing prep solution. And it's wonderful not only to prep the skin for nano-needling, but it's excellent for any treatment that you're doing that you want to remove excess oil, start to bring the pH of the skin down, really prep the skin. So we use it before our peel treatments. Of course, you saw before the nano-needling treatment, dermaplaning, really any treatment that you want to prep the skin with a degreaser. This is a wonderful product. I love it compared to like an acetone or a rubbing alcohol because it is much more balanced. There's a little bit of chamomile in there, a little bit of witch hazel. There is alcohol. So it really brings together a beautiful blend of ingredients. So it does strip the skin, but it does so in a very gentle and balanced fashion while nourishing the skin as well. So that is the eye peel degreasing prep solution. That is a professional only product. So that's just for you licensed professionals and guests out there. Your professional would prepare your skin using that. Let me see if we have any other questions coming in while we're seeing if we can get Teresa back on. Oh, this is a great question. How often can this treatment be performed? So I would imagine that Teresa does a series of treatments, and usually they are 2 to 4 weeks spaced apart. I think each professional can have a different cadence. So you would speak to your professional, and professionals, typically it's 2 to 4 weeks. This is nano needling. So again, we're working more on that exfoliation, that surface exfoliation. We here at Image love to combine, as you saw, our enzyme solution with the treatment, and we will space usually our series every 2 weeks. The full treatment she just demonstrated should not physically peel. Oh, this is a great question. Exactly. That's another thing that I love about this type of treatment, because you don't have downtime. So you typically won't see visible shedding of the skin, which is great, because then you don't have that skin kind of flaking, shedding, hanging off. We don't always want that downtime. And don't forget, just because the skin doesn't visibly shed does not mean that we're not achieving the end result that we are going for. So that work is still being done in the skin, but in most cases, and of course every skin type is different, but in most cases you're not going to get a visible shedding of the skin with this treatment. Does the BHA lift pair well with nano as well? So I am going to cautiously answer this question. Of course, every client is going to be different. It's really going to be determinant on your skin analysis with the client. We always err on the side of caution. And when we're performing our peels from an image corporate standpoint, we will incorporate our enzyme solutions. And then sometimes we'll alternate in a series. For example, a nano-needling, and then our next in that series might be a BHA lift. I would recommend that you work in an alternative series like that, but I know with some of our medical offices, they will do practices that are a little bit more advanced. So it's really going to depend on the client and the practitioner and what you're doing in your office. But I think it's a beautiful pairing in terms of alternating in a series. We just want to be aware of, as Teresa mentioned, trauma to the skin. We want that controlled trauma, but we don't want trauma that's going to result in post-inflammatory hyperpigmentation or an adverse reaction or response in the skin. So again, we're erring on the side of caution. I think that is most suited in an alternative type of approach. I think we had some more questions come in. This is a great question from Sarah. Is the client able to resume normal skincare products, including retinols? Are there any limitations? And how soon should they have other treatments? Perfect question. And I'll segue this into our post-treatment. I'm just going to keep talking until and unless we can get Teresa back on. It's very important. Yeah.
I'm sorry not to interrupt you, but she is going to be on in just a minute, and then we can close out this session like we planned.
Perfect. Okay, so I'll talk about post-treatment until she gets back on, and then we'll close. So post-treatment is vitally important. And there's Sandra, Teresa and Sandra that just logged on. So Teresa, we were just starting to talk about post-treatment. So I'll turn that over to you and let you kind of finish out with how you would conclude the treatment. And then we will wrap up our time together.
Okay, guys, thank you, Kimberly. So we had just, as we last spoke, we applied the SPF, and take a look at her skin, you guys, just how tight and hydrated and bright and youthful she looks. It's just such a wonderful treatment. So to recap everything, we used a great gentle exfoliating ageless cleanser that has a nice cooling menthol feel to it. And we used the in fact, I'll show you guys these just to recap. There's that. Then we used the eye peel degreaser, which is almost like a mini peel to remove any lipid barrier left on the skin. Then we used the two enhancers of the antioxidant as well as the hyaluronic acid. We swept that on the skin. And then we did the nano-needling to follow with the crosshatch pattern. And then we removed the excess of the enhancers, applied the Ormetic Lift Peel, massaged that in and removed that after several minutes. And then we applied the Ormetic cleanser, the serum, which is tons of truly organic certified ingredients with vitamin C for the skin. And then we used our amazing Max Eye Stem Cell Cream, and then finished with the daily, the Prevention Plus Daily Hydrating Moisturizer, SPF 30. And then now, guys, I'm just going to finalize a little bit of the Ormetic Lip Serum. This is a fan favorite from our staff, patients, and professionals alike. This little powerful punch of moisture is so phenomenal. It's got vitamin E and avocado oil, so you don't need a lot. You literally just take a small tiny bit. And I always tell patients this is such a great thing to use. I'm using a different finger here, guys. Normally I apply this with the Q-tip, sorry. And there you go. And then look, her lips just look bright and hydrated, and this feels moisturizing but not greasy at all. So men even like to use this, and I even apply this a little bit at night before I go to sleep, and I'll wake up and my lips feel moisturized and hydrated. And another pro tip, you guys, this is fantastic for when we travel. So not only is it convenient size-wise, but a little trick. I used to be a corporate flight attendant for a private charter years ago. Take a little bit of this on your fingertip, put a tiny bit in the edge of each nostril. And this is because of the consistency, it will trap in all the bacteria and the gunk floating through the recycled air in the airplane. And then when you get off the airplane, you can gently blow your nose, all that comes out with it. And then it leaves your nostrils feeling hydrated and not dry, because the air on the airplanes can leave our skin feeling a little bit dry. So that's another fun little pro tip.
I do that same thing, Teresa, when I'm skiing and also in cold weather, and it helps my nose. So I love that.
So great. Good. See,
yes.
Great. Think alike. I love that, Kimberly.
Yes. Can I ask you, I think there is a blur filter. I know we're wrapping up, but if you're able to remove the blur filter on your screen, we can see better.
Sorry.
But we're coming to wrap up anyway, so that's okay. Well, I think we have answered all our questions, so that's amazing. Thank you so much, Teresa. This is such a beautiful treatment. I learned today, I know our professionals and our consumer guests learned today. You professionals, if you want further information, of course, you can reach out to us. We have a written protocol for microexfoliation that you're able to download. And guests, we want you to reach out and book an appointment with your local esthetician, because this is what they can provide to you. So make sure that you are getting those regular in-office treatments, because that's something that you just can't do at home by yourself. And also it feels so much better when you go to the professional. Any closing tips or words that you would have for us, Teresa, before we move on with our closing?
Just wanted to thank you guys so much for having me today, and from, to all of our professionals out there, you're going to love this treatment if you're not already incorporating it into your treatment menu. Again, such a quick, effective, easy way to get enhanced results with no downtime, less injury to the skin, and actually no injury to the skin, but just those open channels, and penetration goes way deeper, and patient as well as professional, you're going to get great results. So in fact, if you guys definitely reach out, all the protocols are in the training manual, and they're just a plethora of amazing things in there that you can add to your treatment menu.
And I'll just mention, if you are a medical esthetician, if you're working in a medical environment, you also have our MD products. We always recommend our post-treatment kit for post-treatment professionals. That's available to you. Consumers, these are products, and this is a kit that the professional would provide to you to care for your skin as it's going through that healing process. And then for those of you in the medical segment of the industry, we have our MD products that are available. I think someone asked about going back to your regular regimen. So once you've gotten through that first 3 to 5 days that you're using the post-treatment products, you would then go back to your regular skincare regimen. Get consumers out there, if you are not on a good home care regimen that includes a cleanser, a serum, an SPF, and a night cream as just the foundation, you really need to talk to your professional and get on a regular regimen. That's what's going to change the skin. So professionals, make sure you're stocked up in the basics, and you consumers out there, make sure you are consulting with a professional, because if you really want to see change in your skin, that's how you're going to get it. I would say at the very minimum, use those 4 products twice a day, 3 easy steps, and that can be just life-changing to your skin. Teresa is showing us our post-treatment kit. So that's what it looks like. Once the treatment has finished, she's going to send her guest home with those products. And then once that is finished, you would go back to your regular regimen.
Yep.
All right. Well, I want to thank you again so much, Teresa. We so appreciate your time. This was a lot of fun, and again, so educational, and I know all of our guests and viewers really enjoyed it. Viewers, thank you for your patience with technical difficulties. You know, that's what comes with the virtual world. So thank you for hanging in there. And let's see. Oh, how can we contact you, Teresa? What's the best way that we can follow you, get your information, and connect with you?
Thank you, Kimberly. You guys can find me on social media, Instagram, just at Teresa L. Clemens, which I do a lot of training videos, treatment videos, skincare tips, lots of fun things. And I do talk about a lot of different treatments that we do in our med spa at Walnut Creek Aesthetics. And I'm also on Facebook, Teresa L. Clemens as well.
Perfect. Thank you for sharing that information. I know that a lot of our guests probably would love to connect with you and reach out. So we appreciate that. And thank you all for attending this year's ESTY Talks. If you missed days 1 and 2, you can go to the website and you'll be able to review those under our events tab. So be sure you tune in, or just a refresher, you can watch them again. And also make sure you're checking the website for different promotions that are going on right now. So there's lots of information on the website, but I love a good promotion, saving money, etc. So be sure you're checking that out also. So on behalf of our global events department and Image Skincare, I want to thank you all for viewing our ESTY Talks this year. If you have questions, don't hesitate to reach out, and we look forward to seeing you on our next event. Thanks all.
Thanks, guys.